Hi, everybody. Welcome to the 2017 webinar series that the State Unit on Aging is doing this year. We have a great presentation for you today, and I'm going to let Shelley introduce herself and get started in just a couple minutes. I want to remind you guys that you are all on mute, and we do that because we are recording this session, and we don't want to get any of the static or anybody putting us on hold or anything in there. So if you have questions, please feel free to text chat them as we're going along, and I will be keeping an eye on them and making sure that Shelley knows that the questions are there. We did send the PowerPoint out in PDF format yesterday afternoon late, and I also attached it to the webinar as a handout, so you should be able to get that. If for some reason you can't, you can email Lori, L-O-R-I, .c.watt, W-A-T-T, at state.or.us, and just in the subject line say need webinar materials, and she will get that off to you. If it's a group site, please let us know who else is there with you. Put those names in text chat and we'll make a note of them. We appreciate that. I just want to remind you that after the webinar is over, you will receive an email with a SurveyMonkey link, so you can let us know how relevant it was and how you liked it or didn't like it, and what we can do in the future to make things better. So at this point, Christy Murphy is here with me in this room. I'm Sue Ann Jackson from the State Unit on Aging, and I'm going to let Shelley just take it on over.
Great. Thanks so very, very much, Sue Ann and Christy. It's really great to be able to come back and talk about this particular topic. My name is Shelley Zylstra, and my email address says my name is Rochelle Zylstra, so if you get an email from me, that's what it will say. That's my given name, and the federal government does not believe in nicknames, and so that became my email address. But I work here at Region 10. I took Terry Duffin's position. Terry was here for, gosh, I think forever. And he left several years ago, and I worked with Jeanette Burkett for a very short time and really enjoyed the time that I spent with her. She was sort of my mentor in this position. Unfortunately, my mentorship only lasted about 6 months because she retired, and I've never forgiven her for that and never will. My area of expertise in terms of my official training was I'm a scientist. I worked in, I have degrees in dietetics, nutrition, biochemistry, toxicology, and then I have a PhD in nutrition. So have spent a fair amount of time in school learning about things, and do not use much of what I learned in school with the work that I have done. For the last 30 years, I've been working in aging, most recently up at the Northwest Regional Council, which is an area agency on aging up in Northwest Washington. We had the counties of Whatcom, Skagit, San Juan, and Island counties. And so we had some service challenges because 2 of those counties were entirely islands, but it did require us to sit on ferries and watch killer whales on our way to work, so it really wasn't too much of a hardship. I was asked today to talk about working with tribal communities, and I had done this last year, or maybe 2 years ago, I can't recall. That must have been last year, when I talked with you about these issues. And as I was going through the presentation from last year, I was thinking, no, I can't take that out. No, I can't take that out. So some of you may have seen some of these slides, but I have changed a number of them. So I'd like to go ahead and get going forward. Talk a little bit today about what the law says, and by the law I mean the Older Americans Act. A little bit of a history lesson. It's impossible to understand working with tribal people without understanding what's been going on between us for many, many years. Talk about some of the facts in Oregon. I did take time to read every area plan in Oregon from each of the AAAs, and I appreciated a lot of what I read, and so I picked out some best practices and then some successful model suggestions for you for down the road. This is something that I think is pretty available to you all. The Older Americans Act in Section 306A11B says, each area agency shall provide information concerning services to older Indians and assure that the area agency will coordinate services with those provided under Title VI. Now, this isn't just part of the targeting language. Section 306 is where they talk about low income, minority, rural, isolated, frail. This is over and above that. So regardless of income, location, regardless of all of those other targeting characteristics, older American Indians are called out in the area plan, or in the Older Americans Act. The state plan and the area plans then shall require that they coordinate programs under Title III with programs under Title VI. And so there's really two things to think about. Individual tribal members are a target population regardless of anything else. And Title VI programs are required to coordinate with Title III programs and vice versa. And so we can talk about what's the best way to go about doing it. It's important to understand that third bullet that says this is over and above the targeting requirements. This isn't just one of the targeted races. We do talk about low-income minorities, but in addition to low-income minorities, the older Indians is a target population. And one of the things that we would look at to determine if you're being successful in targeting and providing services to older Indians is obviously the service outcomes. How many people are being served? What's the percentage? If 2% of the population in your region is Native American of the older adults, I would expect to see at least 2% served. In Washington State, with the access services like information and assistance, requirement is that they serve double the population in that area. So if there's 2% population of Native Americans, the requirement would be that they would serve 4% Native Americans. The other one there is the moccasin telegraph. You all know that when you go to N4A or some other national meeting, you run into people, you see the same faces and a lot of the same people because our network is small. The network in Indian country is equally small, if not smaller, and there's sort of an unknown, well-known communication thing that we call the moccasin telegraph, and it's basically combination of what people are saying and what they understand and what you hear in other conferences or in other conversations. And knowing that I can pick up a telephone and call somebody, for example, at Klamath and say, hey, what's happening over there? Are you guys being served? Are you guys coordinating? Or when I'm talking with them about something else and I say, hey, talk to the AAA in your area, and they say the Automobile Association, I know that probably we have some work to do. It's tough. I get it. I did a lot of tribal work really from the time I started at the area agency in Northwest Washington. Some of the questions that I got from staff was they weren't going to go out to the reservation because they were afraid it wasn't safe. Recognizing that we are dealing with sovereignty and being delegated the responsibility and the authority for treaty responsibilities is something that I think we don't understand completely in our communities, in that the federal government wrote the treaties, and some of those treaty responsibilities where they negotiated, where the tribes negotiated health care and other types of services, have also been passed on to the state. And so the state has got responsibilities. And when the state passes the monies on for those services, healthcare, education, employment, a variety of different things, the treaty responsibility goes along with it, and sovereignty is really part of that. And that can be a barrier to not understand, well, what do you mean you don't follow that law? Well, ADA is not a law in the nations. Some of them have chosen to do it, others have not. Eligibility can be challenging. With our Title VI programs, folks are allowed to establish what they consider to be the age of an elder. Each tribe says whatever they're going to be. There's kind of a common misunderstanding that all the tribes pick 55. I've got tribes that are 60. I've got tribes that are 45. And it's up to the tribe to determine what age they're going to serve. They're funded, however, on the same basis as you are funded, and that they're funded to feed, for example, the number of people that are 60 and over who are either tribally enrolled or show up in the census in that area. So that's how their funding is distributed. Understanding how things work can be challenging. Indian time, which is a concept of the here and now, is much more important than what's maybe around the corner, can trip us up a little bit, because if you have a meeting with someone and their daughter stopped by to have a conversation with them, the daughter is for sure there and needs to be paid attention to. I might not show up for the meeting, so why would I cut off my daughter to go to a meeting? So they may be late, may not show up. That can be looked at from our perspective as being very rude, and from their perspective, we're doing what we need to do in order to take care of business. We don't have extra funds, and we think the first thing, if we go into the reservation and start talking about let's collaborate, let's do some services, I'm going to have to take money away from my existing meal provider to give them meals. It doesn't have to cost money. I didn't provide any funds for any of the tribes that I worked with in our area. We had 6 tribes in our service area, and not one of them received any money from us. We did a lot of training. We did a lot of assistance with writing grants. We did a whole lot of swapping back and forth. For example, I had a nutrition program that outgrew a commercial range and needed to get a bigger one, and so we offered the smaller one and assisted with paying for the installation of the smaller one in one of the Title VI programs. Lots of misunderstandings. I was on a plane coming back from Alaska just last week, and a woman behind me was talking very loudly and was talking about the fact that she felt like a second-class citizen in her own country. And who do these people think they are? And I tuned in because I was thinking, well, who is she talking about? Well, she was talking about tribes. And there are misunderstandings about the fact that tribal people get, quote, Indian money, that they get free health care, that they get this unending list of things that happen. And when you actually get inside and start understanding what they actually get, the truth is quite shocking to most people. And then knowing how to provide culturally appropriate services, that takes a pretty good relationship and understanding of what's going on in the community. The outcomes that we can look for is we have expanded program services to meet the needs of tribal elders. We see people getting what they need when they need it. Enhanced quality of life for tribal elders. These folks die earlier than we do. They suffer from chronic illnesses at a much earlier age, on average 10 years earlier than we do. It can increase our knowledge about Title VI and tribal communities, reduces unnecessary duplication of services. If we say, look, your people don't have to drive all the way into our community to serve those tribal members that live in town, let us put them on our home delivered meal program. It saves people crossing boundaries back and forth. And it develops partnerships to address unmet needs. In my experience, I gained more from working with tribal communities than I ever provided in terms of support and certainly with funding. This is an old slide. The data hasn't changed because we haven't had a census, but we know that about 1% or 1.8% of Oregon's older adults are Native elders. When I start looking at where services are, these are the registered clients, all registered clients, which are all people that we know who they are. They wouldn't be a telephone call or another contact like that. 1.2%. So from that perspective, it's underserved. That population is underserved. Congregate meals are actually the closest at 1.4, home delivered 1.1. So there is work to be done. The good news is you're not Washington. You won't have to serve 3.6% of your clients in those areas. But there are some things that probably could be done. I liked the map of Oregon because it shows sort of the concentration of tribal communities. And you can see right where the large reservations are. You can see, you know, there's Klamath, there's Umatilla, there's Warm Springs. You've got all of those large populations where the number of people, the percentage of populations are much higher. A telling number here was in 2005, the total number of registered older Indians that were served in the state of Oregon was 646. We've seen a pretty good increase in the population since 2005. And the most recent year that the data is available, Oregon served 564 Native Americans. So the numbers are kind of going in the wrong direction. When you look at the socio-demographic information regard to Indian elders, we know that very few of the American Indians actually live on reservations. The vast majority of them relocated to the larger communities. Portland's got a much higher number of Native Americans than they're going to be out living on the reservations. Only 22% actually live on res. When we talk about the target populations for the Older Americans Act, we're looking for people who are low income, ethnic minority, which we recognize American Indians as, although they do not often recognize themselves in that capacity. Frail in poor health, rural and isolated, and with Alzheimer's or dementia, dementing conditions. When we start looking at the characteristics over here, we have a chart that shows, both of these are from the American Society for Aging or Social Security. Home ownership is often a sign of financial well-being in older adults. People who have owned their own home aren't going to be facing a raise in their rent for unknown timing. All races, 64% own their homes, 48% of American Indians, Alaska Native. 20% live in poverty compared with 12%. Life expectancy at birth, if they were born today, now this is really a dramatic change because the life expectancy of a Native American man when I took my position 30 years ago was 47 years. And so life expectancy now is 73. So we are seeing folks actually living longer. All races is 5 years longer. Fair or poor health, 46% of American Indians are in poor health, 34% of all races. Disability, 23%, much higher in the American Indian population. Median income is about half that of all races population. And here's kind of one that will kind of floored me, but I was aware of it because I'd been out there a lot. 4% of American Indians are grandparents raising grandkids or kinship caregivers. All races population, that's down at 1%. So if you're looking for places to find grandparents raising grandchildren, I suggest that you check reservations, check with urban Indian organizations, because they are going to be places where you're going to find a much higher number of folks doing that. With regard to health status, again, healthcare was prepaid. The tribal members prepaid for their healthcare by giving us the state of Oregon, okay? That was all tribally owned at one point. And the state of Oregon, the tribes got together and developed treaties, and Klamath said, okay, we will give you our land in exchange for these things. Grand Ronde said the same thing. Warm Springs said the same thing. And so they wound up with reservations and with guarantees that they would have health care. Treaty rights included education, food, the ability to practice their own religions, and then healthcare. And the Indian Health Service, which actually started off as a branch of the War Department, it sits on the discretionary side of the budget. So if Congress cuts, it's not an entitlement service in terms of its budgetary standing. It's on the discretionary side. So we do know that it's not uncommon at all to see Indian health clinics at what we call priority 1, which means the person at some point during the year, they will send out a notification to their people and say, we are now at priority 1. What that means is the only thing that will be covered is life or limb. So if you're going to die from it, they might help you out. Or if you're going to lose an arm because it's hanging, well, we might be able to help you out. But everything else elective is put on hold because there is no more funds. Cause of death listing here, we show the difference. These are actually the ratios of cause of death, American Indian and all races. Obviously, when you see it lower than 1, it means that we have less risk in the American Indian population than we do in all races. And that's the case with heart. Cancer is virtually identical. But with all of the other causes of death, with injury, natives see 2.5 times more injury and death from injury. Diabetes is almost 3 times. Liver disease is nearly 5 times. Even flu shots and pneumonia, or flu and pneumonia, cause almost double. And then youth suicide is really an epidemic in Indian country, and that seriously affects the well-being of the elders when they see a young person losing their life to suicide, and it causes lots and lots of harm. Life expectancy is in the low 70s in region 10. The number up above, or the one we talked about before, is the 73 is just all across the country. In our region, it's in the low 70s. I think the lowest is in the South Dakota region at 68 years. So they can look forward to 3 years of retirement. It's not news, though, when you start looking at what's going on with the disparities and the things that were problematic. We have what was called the Columbian Exchange, and this is a kind of a map of the Columbian Exchange. It shows what we got from Europe and what they got from us. And so you can see that the things that came from the Americas to Europe, Africa, and Asia included things like the tomato. Imagine the Italians without a tomato. They got corn, they got pineapple, they got peppers, they got potatoes. Those were all things that were taken from the Americas and brought over to Europe. On the other side, you see the things that came from Europe and came to the Americas. Where would Florida be without citrus fruits? And where would California be without wine country? And how about Costa Rica and bananas? So there's lots and lots of things that have come from Europe, and there was some good exchanges. But I'll call your attention to the red box on the right-hand side of the screen. And those were diseases that were unknown in the New World. Smallpox, influenza, typhus, measles, malaria, diphtheria, pertussis, all of those really, when brought to America, the tribal people had no resistance for any of those, and they were just wiped out the population. This is, again, another slide that I used last time, and it's a sort of a short history. I would encourage you to spend some time actually looking at it. What I am kind of amazed at is how little we really understand from the history books in the communities that we, in our 8th grade world history or U.S. history book, some of this stuff just wasn't even addressed. In 1778, the Continental Congress said anything west of the Appalachians were where the natives could hang out. We're never going to go there. Then in 1830, they said, oh, okay, well, we're moving our boundary and everybody's got to move west of the Mississippi. That's when people started being removed from their communities. A lot of them went down to what we called Indian Territory, which is now the state of Oklahoma, and moved tribes from all over the United States into that area. One of the things, if you recall, on the treaty rights that we talked about was education. So in 1880, the first boarding school was established, and sending kids to boarding school was not an option. It was a requirement. That was what the states did. That's what we did as a country to meet that treaty right. We said, okay, we've got boarding schools, and this is where they're going to go. Dawes and Curtis Acts basically took more assimilated Native Americans by giving them plots of lands rather than giving them reservations. That same Curtis Act actually took back Oklahoma from the Indians. It had been given to them. They had relocated a bunch of Indians. I think you may have heard of the Trail of Tears. But in the Curtis Act in 1898 actually took it back and turned it into a state. In 1924, Indians finally became citizens, and they were allowed at that point in time to come off the reservations and move about freely. They actually all were able to vote not until 1965. In 1934, there was a tremendous movement to help people to get back on track because the tribes had lost a lot. And in 1952, they had what was called the Relocation Act, and that was an encouragement for people to move to population centers. And the population centers were places like Chicago, Los Angeles, San Francisco, Seattle, Portland, were all areas where people were offered an opportunity to come and get a job and move off of the reservation. And it was that Relocation Act which moved a lot of people off the res and into the communities, into the urban area. In 1953, there was an act which was passed called the Termination Act. And what that basically did was said, we don't have to do anything. These treaties are all hogwash, and we're not going to do any more services. So all of their federal programs were canceled. There was no more money coming in for health care. And for the next basically 25 years, there was nothing happening. And they were finally reinstated in 1975. So brief history lesson, but an interesting thing. For the Oregon perspective, I would really encourage you, this is a link to a PBS broadcast that I happened upon, and it is an excellent presentation about how this took place in Oregon and what happened there. The boarding school's going to spend a little bit of time because this really has a lot of impact for the people that we're going to be serving. This was compulsory. Parents were told that if they did not send their children at age 5 to boarding schools, that they would not be able to get food for their other kids. And so they were sort of between a rock and a hard place. But it's important to realize that, yeah, the 1880s seems like forever ago, but the highest enrollment was actually in the 1970s. And the first time that tribal parents were allowed to say, no, you can't take my child to boarding school was in 1978. And, you know, some of us can look at 1978 and say it wasn't that long ago. Children were sent to distant schools, and they were not returned for summertime or for holidays, or, you know, they didn't come home for Christmas. They went at 5, they returned at 18. There was a lot of abuse. They weren't allowed to demonstrate any language or culture. And what this effectively did, because the tribal tradition is an oral tradition, it basically eliminated traditional ways that children learned how to be an Indian. And so what wound up happening was the language was lost, the ceremonies were lost, the foods were lost, the traditions were lost, and people were returned at 18 to come back to the community. And to some extent, they were shunned when they got back because they were literate, but they didn't know anything about what it meant to be an Indian. There's some definitions, and this is another old slide, but I think it's so important. And we all know coordination is just open discussion, sharing data and information. We do that a lot with a lot of different groups. Collaboration usually involves some sort of a memorandum of understanding, basically defining, you know, having a voice, what we're going to do, how we're going to work with one another. Often there can be a joint funding commitment with a collaboration. Cooperation, it's usually we're going to work together to try to meet a goal. We follow up on the project goal to see how it went, and then we plan how we're going to continue it. Partnerships usually involve written agreements, and you know, we can do all of these things with tribal communities, but when you start working in Indian country, what you will discover is that it's about the relationship, and that's something that we may not be comfortable with in our communities. We're not used to having a person with whom we have a contract call us about something totally different because we have an established relationship with that individual. So it goes beyond the workplace, and we will discover that the friendship and the relationship is something that's held in very, very high regard, and there's a certain amount of trust that's expected between tribal members and non-tribal members who are working in this capacity. When I sat down, I looked at all the plans because I knew there was a section in there for providing older Indians with services, and how do you plan to serve these? And I sat down, I read them all, I highlighted some places, I underlined other places, and I think that by and large, there were some that were very, very good. They were thoughtful, they were complete. It was quite clear that there had been actual discussions and conversations with tribes in developing the goals and objectives and the work activities. Some of them were pretty light, you know, and I understand light. I had a lot of light goals and objectives in my area plans as well. They were, you know, we will try to get a hold of people and talk to them once or twice a year. there was a few that had some misunderstandings, and I thought, well, I'm not going to call an individual AAA out, but I will talk about some of the misunderstandings and some of the issues that I think really do need to be addressed. I want you to think about these. First thing is that Native Americans and American Indians, they prefer First People, Native American, American Indians. There isn't a correct or incorrect way of doing it. I think Redskins is generally not accepted, which is the reason for the arguments with the football team that goes on the East Coast. But it's not just targeting another minority. And we think, when we think targeting minority, we think of interpreting documents. We think of serving meals with rice if we're serving an Asian population. We think about making services accessible by making the services palatable. But what do you do with a tribal member? They speak English, so you don't need to translate. So that's out the window. And I think a lot of people think that if in fact they speak English, the barriers are not as big a deal as they might be with another population. But frankly, nothing could be further from the truth. Okay, another misconception is that there was several plans that said we don't have any tribal communities in our service area, therefore we don't have to do anything. And that's not the way it is. If you don't have a reservation or a tribal center in your service area, it doesn't mean that you don't have to reach out to Native Americans. Remember, we talked about the fact that 22% live on reservations and 70+% live in communities, urban communities and or in town or off the reservation. When I did some reviews of some of the tribal, some of the area plan areas where they said we don't have any, so therefore this doesn't apply to us, I found that in some of these areas there was their minority population was primarily Indians, and they had a higher number of Indians in their region than they did in Oregon statewide, which meant that they did have a responsibility to target over and above the minority population. I want to just point this out, and petitioning a tribal casino for funds is not considered tribal outreach, and I'll just kind of drop that one and leave it there. The other thing is asking a tribe for money to provide meals for tribal members flies in the face of the targeting language in the Older Americans Act, because if we're targeting services, that means that if there's a limitation in the funding, that these groups of populations, this population's over here, the rural, the low income, the minority, the Native American, should get priority over the rest of the population. And that's what targeting is about. That's our services should be first to them, and if there's room, then the rich white Anglo-Saxon Protestants who live in a nice house on the beach should have access to these services. And so it would be, if in fact you petition tribal casinos or tribal members for funds, I think that's fine. They're often very willing to work with you and provide funding that way. But if you say, I can't serve your people unless you give me money, it sort of flies in the face of the targeting requirement, and I think you need to rethink that a little bit. Some misunderstandings that I read, and this was something that I found very common, because 55 is a very common age in Oregon to define elderhood, people would think that people could call themselves an elder at 55, but the number is defined by the tribes. Most of them are 60 now, actually, because people are living longer and the money hasn't increased. But they are funded based on the number of elders in their service area that are 60 plus. So they may have 300 elders who are 60 plus, and they may have another 300 elders between 55 and 60 because of the baby boom, and they are only funded for the 300 elders. Another thing I'll point out, annual contacts do not a good marriage make. And if we're talking about relationships being sort of the key to tribal connections and tribal work, I think it's important to realize that an annual talk or an annual contact does not always work. And it will not be sufficient any more than, it will not be sufficient any more than talking to your wife on your anniversary will be sufficient in establishing a good relationship. Relationships are built on mutual respect. Mutual respect comes from getting to know one another. And I would say that even monthly contact is probably not sufficient. It needs to be contact when contact is needed. There's also kind of a general misunderstanding that tribes have many services for their elders. They're generally horribly underfunded. We talked about what Priority 1 means for Indian Health Service, but oftentimes there will be services, but they may have home-delivered meals. Their program grant funds start in April, and they may have home-delivered meals April 1st through the end of January, and then they've got nothing for February and March because they simply have used it up. I think there's also a misunderstanding about the amount of money. The Title VI Part A is the funding that would be the equivalent to Title III in our communities in the AAA world. And Title III, Part A or Part B and C, we fund transportation, information and assistance, and meals with those. And with Title VI Part A, they're expected to serve meals, they're expected to do information and assistance just like we are. And they're also, you would use this to provide transportation, INA, nutrition, manage the program. When I took all of the grants funds in the state of Oregon and divided it by the grantee number, I came up to $114,000. So think about trying to provide transportation, information and assistance, and nutrition in any group of people and administer the program for $114,000. And you'll know that they are very, very underfunded, even more so than what Title III programs are. The other thing that was a misunderstanding is that Title VI programs are not able to limit their programs to enrolled members. They are required to serve any Native American. And to be perfectly honest with you, they will serve non-Native Americans because they're a culture that has been hungry. They understand what it means to be hungry, and to refuse food means that I think you deserve to be hungry, and they've experienced that. And so I don't know anybody who would ever turn anyone away from a Title VI program. And they do serve, but they are only funded for the number of people that are actually enrolled. This can be a challenge because we may have a relatively small tribe that's in a location where there tends to be a lot of in-migration from other tribal members. They won't get credit for anybody except those who are enrolled. So they may have 100 people that are enrolled in that particular tribe, but they may have another 300 people who are not enrolled in that tribe but who live on that reservation. And so it's really tough to try to say how best to fund them, but a lot of tribes are using enrollment numbers for that, and that's how they're funded, with funding bands. There was a ton of really, really thoughtful, innovative, and effective ideas, and I want to share some of those. There were a couple of AAAs that had no reservations, and rather than focus on reservations, they focused on agencies that served tribal people for outreach. Portland Area Indian Health Board was a good example of an organization. We have NIA, NARA. They worked with the federally qualified health centers in their region because that would be a place where people who were low income, who likely are tribal members, would receive their care. Also veterans programs. Usually, I don't know in Oregon because I didn't look it up, but usually the number of Native Americans in terms of percentage of population is double or triple that of those of all populations. So veterans programs are another great place to find tribal members to target services to, or to find them to give them information about what's available. I think the other thing that was identified, a couple of AAAs talked about linguistics being more than just phonetics and language. Quite clear that they were understanding the importance of communication styles, face-to-face meetings, ongoing meetings, that there are certain things that are sort of expected, and that was very evident in some of the plans. And there was some AAAs that were talking about care coordination staff, having people who specifically identified with the tribal populations as one to serve. And I will say that I do not believe that a tribal outreach worker needs to be a Native American. I think you can do it successfully regardless of your color, but it will serve you well to have the same individual working on the reservation with the population to the extent that it's at all possible, and having one person identified to serve that community, because the community will get to know that person and accept them. If it's not working, it could be that you have the wrong person in that group. Another thing I saw that was very helpful was some plans for some what I call multidisciplinary teams. And these are teams that would come together much like some people call them an A team. They're a social service event where people maybe get together to staff a particularly difficult client case. This might be happening around abuse. It might be happening around unmet needs. It could be a bunch of different things. And participating in these is very, very helpful to the tribe, to the tribal elder who's needing the assistance, and to you to find out actually how things work and how things are going down. I think our staff participated in the multidisciplinary teams, which were called a variety of things. Some people call them just the Elders Committee. Other places called it the Elder Protection Team. But basically, whoever needed to be there was there. The police, the housing department, tribal attorneys, and then we had our social workers at the table. I was often at the table to determine what needed to be done on behalf of that elder and make suggestions about ways things might be able to make things work. I saw talking about elder abuse agreement and team efforts on elder abuse, and this is a type of multidisciplinary team, but if you're providing elder abuse care or working to coordinate elder abuse care or elder abuse investigations, having an agreement with the tribal community with whom you're going to be working is really a good plan. And you do that by going out and sitting down and saying, hi, I work for APS and I periodically get telephone calls to come on your reservation to do investigations. How would you like me to do that? Remember, they're a sovereign nation. They may ask you to call and connect with their social service director. They may tell you just to make a telephone call to the chief of police and let them take it from there. It's going to vary from tribe to tribe, and don't assume that if it works one place, it's going to work someplace else, because if you've seen one tribe, you've seen one tribe. I saw resource guides planned with tribal resources and input by tribal resource experts to make sure that those were there. I think it's important to recognize that it's helpful to have a telephone book or a directory where tribal people can pick it up and find their telephone number for their tribal chairperson or their elders program. Tribal specific dementia training. I did a kind of a survey for the Alzheimer's Association here in Washington State, where they were doing some outreach with tribal members, and I make telephone calls to the tribes in Washington. Every single one of them said what would help them the most with regard to dementia care is training. Keep in mind that, again, 30 years ago, people lived to be 47. People at 47 generally don't get dementia. Now they're starting to live longer and they're starting to see dementia. And the dementia is relative to the poor quality of general health and the poor lifestyles and things that people have to live with when they're living in poverty. So we're seeing dementia in Indian country for the first time. It's an unknown thing. They don't know how to work with it. They don't know how to understand it. They don't know how to communicate it. They don't understand the etiology of the disease. They basically know nothing about it. And doing some training with regard to Alzheimer's dementia or dementia of the Alzheimer's type, as well as services for them, would be incredibly valuable for this population. There was also some discussion about cross AAA coordination. And what I mean by that is that if you ran into a tribal member who said that they have someone living in another AAA's jurisdiction, that you could work with the AAA to help try to get services to that individual who lives far away. There was discussion about that type of coordination, and I think that's a lovely idea. Identification of tribal strengths. That was another thing that I really appreciated. With a couple of the plans, people were identifying the strengths that they saw in the tribal communities and capitalizing on that and asking for training within their own groups and seeing what was happening with them. And a lot of plans, or not a lot, I think there was 3 plans that talked about collaboration on events. Now, Oregon has had a long history of providing the Native Caring Conference and, working with the tribes on that, and that's lovely, but it's not sufficient. It's a great caregiver model. It's probably a model for the country, and there's a whole lot of work to be done. The other thing I saw was outreach to leadership. Tribes, as sovereign nations, have leadership that are elected, just like our elected officials, and need to be treated with respect. And outreach to leadership is helpful. One of the places where I believe the federal government falls is that we do outreach only to tribal leadership, and it never makes it down into the field. And so make sure that when you're making your outreach, not only to tribal leadership, but also try to involve the social service department, the director of the health clinic, the Title VI director, in the work that you're doing and in the way that you're trying to plan services. I saw AAA saying that they were going to use tribal specific models, and they were going to use proven tribal specific models. An example is partnering to provide wisdom warriors, which is an evidence-based model using the Stanford University chronic disease self-management program. Working with IHS on different partnerships. They have diabetes trainings. They have other evidence-based models that we can certainly collaborate with them. And then, of course, that Native Caring Conference, which is really an example for the nation. Including representation on advisory councils is critical, and it's not enough. Having a token Indian on your advisory council isn't what this is about. Maybe that individual is going to be outspoken enough to be able to speak up in a group and say, this isn't going to work in Indian country. But the AAA also has to be prepared to listen to it. Another thing I'll point out to you is that a tribal member is unlikely to be willing to talk on behalf of tribal members in other communities. It would be like me saying, I think what Canada really wants is this. I really don't have a right to speak for Canada. I'm an American, even though I live right on the border. Native American people treat one another in the same way that you and I would treat Canadians, Mexicans. They're Mexican nationals. We can't speak on their behalf. They make their own decisions. And so when you're developing your tribal, your advisory community, I would say that if you have 2 tribes in your region, you probably want to have 2 slots on your advisory committee so that both tribes are represented there and they're not having to speak for one another. It puts people in a very uncomfortable position to ask them to do that. I think the thing here, recognizing that state boundaries sometimes prevent outlying tribal members from accessing their own tribal services. I hear not so much from Oregon, but from other states, not even in Region 10, that, quote, they have their own programs and they can just doggone well go to them. When we have a tribal member who is living far from their own services, they need support probably worse than another person that's living right next door to them because they may not even have the education to know that they're in existence. Tribal members generally access services on the reservation, and if they needed help, they would go there. So finding these folks that are living off reservation, out of their service area, that's a real target population for me. I saw evidence that people plan to go to Native events. They were going to attend things, and I think this has been helpful. I have several things here that I have attended and done and that have stood me in good stead and let people know that not only am I interested in their community, I'm interested in their culture. First salmon ceremonies, some of these are open and some of them aren't, and some of them are open in some communities and not in others. So again, the relationship will let you know. Attending a naming, attending a funeral. If you've been serving a person, attending a funeral is something that honors that individual. Tribal funerals tend to be multiple days long. in the Coast Salish tradition in particular, but also in our sort of highlands folk in Eastern Oregon and Eastern Washington. They often will have a prayer service the first night, which is where I generally attend. The funeral itself is usually the second day, and it's usually much longer, involves a giveaway of gifts and a lot of other things. And because I've always been a little bit loath to receive gifts from these people, I don't want them thinking that I am there only to collect stuff. I generally go to the prayer service and make sure that I pick up a paper and share it with my staff when I go back home. The canoe journey, there are some Oregon tribes who are participating in the canoe journey, and I would really encourage those of you who have an opportunity to take a vacation day or two and move on up north and see how that's working, because it's a pretty amazing chance to see Native culture in action. Gosh, I'm going backwards here. Suggestions for success. You need to know the staff personally. You have to be on a first name basis with them. You need to work with them the same way you work with other community organizations across town. If we know one another, we know our capacity. I bet there isn't one person listening on the phone, which I have to say is very difficult because I can't see if you're rolling your noses at me. But almost every one of us has had the experience of saying, you know, let me call so-and-so. I bet they might know what's going on. And you pick up the phone. It has nothing to do with anything that they have anything to do with, but you ask the question anyway, only because they live in the area. They have a personal understanding of their community and the way things work. And it's not just relying on the statistics to talk to you about the hopes and dreams of the program. You'll pick up the phone and you'll be able to say to them, hey, Eloise, we have a stove here that might be work really well in your kitchen, but it's too small for ours. Would that be something you guys might be interested in having or doing? I think it's important to recognize that that relationship is it. And you establish those relationships by just stopping by. I used to just go to lunch. I'd pick a day or two a week, and I'd just go from one reservation to another reservation and go have lunch at their Title VI program, just to see who they are, meet the elders, pour coffee, help with things. If you see an elder who drops their fork, stand up and go get them another one. Ask about simple things that might help. It might be collaboration that's as simple as a ride to a meeting. Be offering to proofread a grant or make suggestions on a grant or strengthen the grant writing that they're doing. Coordinating cooks training is another one that has been very, very helpful. They may have one cook and one Title VI director. And if you can get your Title III director to combine their services or to combine their training or allow the tribal cook to come for training, it can be a great way to sort of break the ice. If you don't get a response, try another avenue. If the second avenue didn't work, go face to face. There are huge cultural barriers that exist within our communities caused by generational trauma, loss of self-worth, loss of cultural identity. And the barriers that exist may not be cultural barriers. It just might be rural and isolated barriers. We have the same struggles trying to get hold of wheat farmers in Eastern Washington as we do with tribal communities because they're just not used to being in crowds. So I just cannot encourage you enough. I hear it all the time. I called them and they never called me back. I sent them an email, they didn't respond. Well, the best way to show them that you're truly interested is send them an email that says, hey, I'm going to be at the res next week on Thursday. I think I'll stop by for lunch. Can you meet me at the Elder Center? And go. And if they don't show up, you're there anyway because you just became a person of your word. Don't assume that if it works at one tribe, it's going to work at another. Again, knowing one is knowing one. Common threads with tribes exist. There's a healthy skepticism because there's been lots of promises that have not been fulfilled. The other thing that they share is an enormous respect for their elders. And the elders are viewed as critical to leadership and critical to the well-being of the community at large. Whereas we as non-Native Americans view our communities as being, it's a whole bunch of individuals who all work together. But I don't have to necessarily do something for you because I feel like I have to. In Indian community, the community is looked at as number one, and part of the health of that community is going to be how well the elders are doing. The other thing to keep in mind, again, we talked about this a little earlier, is the only important stuff is what's happening this minute. Don't be offended if another event preempts a meeting. A story for me, I was asked to come down to a particularly remote tribe in our region. It was a 3-hour drive up into the mountains, and they had asked me, their cook had called me at home and said, hey, do you know how to cook elk? And I said, well, yeah, I know how to cook elk. Well, I got elk, and I have to tell you, I've never cooked elk. And I said, well, I'd be happy to come down and help you cook elk. So I took the day off and I drove down. I had to get up. In order to get an elk roast to come out and be tender at noon, you have to get up and get it in the oven fairly early. And it's 3 hours away. So I got up at dark 30, drove all the way down to the place, and the kitchen was dark. And I thought, well, this is pretty weird. And so I kind of kicked around. Finally, I went over and knocked at a house that I knew a little bit about the family that lived there, and I said, hey, I was supposed to meet the cook at this place to cook some elk for the gathering today. And they said, oh, the gathering got canceled. And I said, what happened? And there had been a death. And when there's a death, everything stops, because it's the community's responsibility to focus on the needs of the bereaved family. And so the event, regardless of how hard they've worked on it, it will be canceled. And it would be a very, very big surprise if, in fact, it went on. So keep that in mind. And so I went back and enjoyed my afternoon. It was a lovely drive back home, and it was a beautiful day, and I just took it in stride. It was the only thing I could do. Suggestions for success: there's nothing ruder than interrupting, especially an elder. Elders will talk and they'll stop. And sometimes the pauses are longer than we're used to. And the pauses are for thinking. The elder is thinking about what they may be going to say next, or they may be there to give you a chance to listen with your heart instead of your ears. And they're not fulfilling. And we get so uncomfortable when things get quiet. I bet when I was quiet a minute ago, you guys thought that we had a technological flaw. And so we instantly jump. We've got to do something. We've got to fill that hole. Just wait it out. Just wait it out. Humor is important. I have had more belly laughs at tribal dinners than I care to shake a stick at. And humor is very important, and they love to joke around with one another and tease one another. And this is part of the culture that makes the relationship so sweet. Also, food is important. Do not have a meeting without it. And I mean that very strongly. If, in fact, you can't figure out a way to get some cookies to a meeting, or some fruit to a meeting, or provide a lunch periodically, then don't have the meeting. Yes, I know you cannot provide food with federal funds unless it's for a meal program. That's why we get a salary. And I have cooked many a lunch with my own dollars for tribal members and meetings. Unfortunately, it's a fact of life. If you're truly invested in making sure that this works, make sure you've got food at your meetings. It doesn't have to be fancy, but I really encourage you to do it. It can really be a draw, and it makes a recognition of the importance of getting together and breaking bread together. That can break down barriers. Another suggestion is that if you don't know, ask. Study U.S. history, but study it out from under the same umbrella that we all studied U.S. history. Work to understand local tribal cultural traditions. Get some reading materials. I knew very little about Alaska Natives when I took this position, and Alaska is one of my states, and so I needed to figure that out. So I've been reading a lot of great stories written by Alaska Natives so that I can understand kind of the way of life up there, and it's been a real eye-opener for me. Make sure you understand Indian Health Service and how it's operated in the local tribal communities. Look up what is a 638 tribe, and I'm not going to tell you. Suggestions for again, here's something to think about. In 2016, I think it was in February thereabouts, CMS changed the rules about what we refer to as 100% FMAP for tribal services. Now, you know that Oregon pays a percentage of the money, the match for Medicaid dollars. Well, there used to be that 100% FMAP, which means 100% of the money is federal, 100% federal match. It means the state of Oregon puts nothing into it, if in fact they're provided in a clinic. So I'm sure that for many years, a tribal member who goes and gets services at Yellow Hawk will get those under Medicaid, and Oregon won't pay for it. They'll bill the United States for the full 100% of what that service cost. Well, the rules changed, and they no longer have to be in the clinic. If, in fact, a tribe has established a care coordination agreement with a provider, those services can be also 100% FMAP. An example would be this. If I'm an IHS provider and I want to make a referral to a cardiovascular specialist in the Portland area, I could in fact have those services paid for under Medicaid with 100% federal funds if I have a care coordination agreement with that provider. And what that basically can amount to is a promise that he will share the results and send the client back to me. The patient remains my patient. Well, that it has been used in a lot of areas to great advantage. I'm not sure how much Oregon is using it, but it's something to think about and bring up, because Oregon, like all the other states in my region, are struggling from a financial perspective, and being able to get 100% federal money and not have to pay half of the cost of the care for these tribal elders is really, really a way to look at money coming into the state. In addition to the referral issue and the care coordination agreement, they expanded the services to include those services eligible for 100% FMAP to include those things that are not really doctor services. And those services include Medicaid transportation and long-term services and supports. And so if in fact you have an Indian elder who is receiving services through Medicaid, those services would in fact be eligible for 100% federal match under two circumstances. Number one, that there's a care coordination agreement between the IHS service provider or the clinic and the case management program who's providing the direction, or if in fact they're provided under a tribal service such as established an adult family home or adult foster home, a home care agency, etc. So keeping in mind that any tribal elder could potentially be served with no cost to the state of Oregon if these things are exploited, and I mean that word, I think it's important that we think about how to set these up so that basically the federal trust authority or trust responsibility is identified and met. I have shared this story. I think there's some new people. I got a list of who was signing up, and so I'm just going to share this briefly. In 1990, our area agency decided to develop an outreach program for tribes, and this person circuit rode to all 6 reservations. Basically, they went and ate lunch and visited with the elders, and they sometimes stood up and shared information like, hey, it's open enrollment, time for Medicare. You guys want to have me come out and help you sign up for Medicare, just let me know. And we funded it with admin claiming dollars through Medicaid and Title 3B, 3D, and 3E, because she was working, doing some trainings under evidence-based models as well as doing caregiver support. And so, but the vast majority of the funding, I would say probably 50% of it was admin claiming, because the work was with a population which was so low income that almost every time she went out, she was doing some work with working with someone to get on Medicaid or to use their Medicaid services. The picture there is actually a picture of our current The current tribal outreach worker, Becky Bendixson, is a Unanga elder from King Cove, Alaska, and there she is wearing her regalia. The purpose of tribal outreach was to share ideas, collect information for planning purposes, talk about services available, and help elders to get signed up, give feedback. If she found out that a home care agency had committed a sin, she would give feedback to the home care agency about what might have been a better approach. Develop and share evidence-based programs. So she actually participated and continues to train in the Wisdom Warriors model today. Communicating programs about clinics, schools, preschools, elders that need support to make connections in town. We didn't limit it to only elder services because people with disabilities would have different needs, and so connecting the dots between the silks in town and the tribal communities was one way, or trying to work with the children's programs in the schools or the Head Start programs was also part of it. She did monthly Title VI training on a variety of different things, and her goal was to establish relationships with the local communities. They traveled together. We attended cultural and business events together. We set up billing agreements. One of our little tiny tribes was getting well over $100,000 a year through a contract that we established with the state to provide Medicaid transportation. We collaborated on grants. We got thousands of dollars through the years of tribal-specific grants, from everything from nursing home diversion to oral health to foot care. And the best result was that thousands of Indian elders wound up on the Medicaid waiver services, receiving the services that they needed in their communities with tribal providers, and they aged in place, which was really the goal of the program. These are some of the things that we did. I'd be happy to talk with you about any and or all of them, but I think it's important to recognize that it sort of depends on what you're interested in doing and how you decide you want to move forward to see what kinds of successes you can make in your own area. Oregon tribal needs, these are things that I have picked up in talking with the tribes. They are caregiver services, although they've got the Oregon Native Caring Conference. The quality of the caregiver programs varies tremendously in Oregon, and I would say that would be one area, if you just wanted to offer help, they would be really willing to hear about how to set up a program. Training about Medicare and Medicaid. A lot of the directors are clueless when it comes to how to get somebody signed up for Medicare, and a lot of tribes are confused about even Medicare Part D. We had one tribe in our area that was signing everybody up for the same thing because they wanted it to be equitable. Well, in some cases, it didn't even cover any of the drugs that the elder needed. Facilitating access to waiver services for elders is critical. They don't know the system. They don't understand it. They get services too late, and by the time they get services, they really are going to need, a lot heavier interventions. They're much more expensive, and they've lost ground personally and as a community. And it's important for them to understand what is available to keep them whole and healthy for the longest period of time. And then assistance to contract for Medicaid reimbursement for services that they are providing, helping them to set up an adult daycare, for example, and to set it up so that it would be reimbursable under the waiver, teaching them how to use the tribal dietitian to get services for their people under Medicaid. The sky's the limit. Again, I know you have ideas. The plans were full of really wonderful ideas and suggestions. Read one another's plans. You'll see good, bad, and ugly, and I encourage you to work together to make them all good. Contracting, again, this is a reused slide, but when you do contract, remember that they are a sovereign nation. I actually refused to contract with any of my tribes for that reason. We were a council of governments. I said, it's beneath your dignity to have to contract with us. And so what we usually did was try to negotiate a contract directly with the state, and that tended to work a little better. But if we did have to contract because it was the way the system was set up, we recognized that we had to have someone who was a champion on the reservation to work. We had to review our process for barriers. A good example of that is if, in fact, we had a case management requirement that our case managers had to have an MSW. Well, a tribal member with an MSW is not going to work as a case manager for $60,000 a year. They're going to be working as the director of the social services department for $200,000 a year because there are no MSWs. And so making sure that you weren't automatically screening out viable candidates for these programs. Remaining flexible and realistic, understanding that they may not have the technology that we've become so dependent on, and just assume that everybody has it. You may need to assist them with the process and review the final product with them to make sure that they've dotted their I's and crossed their T's. And the other thing to remember is that they serve a higher power. And what I mean by that is I had one contractor here in the state of Washington who was mad as a wet hen because the tribe would not give them their they were offering Medicaid transportation services, and one of the requirements was that they had to provide a maintenance schedule. Well, I said the reason that they don't is because they're using GSA vehicles. Well, what does that mean? They still have to have a maintenance schedule. And I said, you don't get a GSA vehicle without a maintenance schedule. It's part of the package. And they, basically they don't even understand why you're asking. So it's important that you identify that there may well be a hoop that they've already jumped through that you can skip rather than making them do it again. When times are tough, and they are right now, thinking about what 100% FMAP could mean to your state and your state budget. Multicultural focus can tremendously strengthen your grantsmanship. I review federal grants and have for many, many years, and it's amazing to me the number of people who just forget that they've got neighbors. They'll talk some highfalutin academic stuff about how well they're going to do something, but they never really focus on the people they're going to serve. And so it's helpful from a grantsmanship perspective to include tribal identity, tribal activities, tribal target populations in your grants. And then helping you to establish programs and supporting your existing staff. We managed to go for 30 years without having to lay anybody off in spite of some really tight times because we were able to get grants, and a lot of those were based on our tribal relationships. So if you want to discuss with me, there's my contact information. My telephone is there, and if I'm there, I will answer the phone. And I would welcome any questions or comments or concerns or thoughts that you would have to share with me via email, telephone, or on the telephone today. So that's really all I have to say.
Shelley, that was awesome. Thank you so much. I've been watching and I haven't seen any questions, but that's probably because you were talking really very thoroughly about so much. I'm not sure, it's probably taking people time to sort of take it all in. But there was a lot of information in that. That was amazing.
Thank you so much.
We're both sitting here. Christy and I were both sitting here taking lots of notes and looking at each other going, yes, thumbs up, thumbs up.
And I'm sure there was a thumbs down there too, and maybe a wiggle back and forth. I understand these things. That's what makes these webinars so tough. When you're with a group of people, you can tell when you've totally missed the mark or said something that's diametrically opposed to the way things work there. But I'm willing to stick my neck out because you're good people.
Thanks. Well, like I said, I've been watching for questions and I'm not really seeing any, although, we're giving a couple minutes here if people have questions and can text chat them in. But Shelley did say she's available and you have her information there, and we can also if there are specific topics, Christy and I can always set up another webinar with specific regions or however that works best.
Yeah. Or even a conference call. I'm really willing to work with folks if they are, needing some assistance or some advice. And pay attention to your deadlines. There was a lot of people who had June deadlines, and I wanted to pick up the phone and call the tribes and say, I found that this AAA is going to do this by June 2017. Did they? And I didn't do that. So
okay, we do have a couple questions, Shelley.
Sure. Yep.
For type A AAAs, because here in Oregon we have A's and B's, and the A's
Right.
do not do the Medicaid. So
Correct.
for the type A AAAs, can the FMAP info be used, or is that only relevant for the type B's that actually provide the Medicaid?
It's relevant across the board, and the reason it's relevant across the board is that the AAAs that are working, that do not actually work with Medicaid, can certainly be making referrals and understanding that the referrals that they make for contracting with tribes in their areas will save the state the money. And so understanding that is something that, it doesn't apply to any funding source except Medicaid, but knowing that it's there, it's available, and exploiting the availability of it, if you've got tribes in your area, means you're going to be able to serve more people with less money. And when you start having waiting lists for Medicaid services, that's when you know that this could really be used to your advantage. So I would say, yeah, go for it. You know the people, the relationships exist with you, and you know the other AAAs. So I would use yourself as a conduit to connect the dots.
Great, thanks. I'm also seeing a question that says, if there is not a reservation in your local area, what is the best source of information to get in touch with people? And I think you touched on that earlier. You were talking about the one program that found agencies like NIA and the Health Board and some other things.
Exactly. And I think another couple of ways of doing it is churches. If you know that there's a church that happens to have a large population, is one way. Communities of faith. Veterans organizations, the VFW. Often if you're in an area where there are a veterans group, there will be tribal members that are going to attend that, and going there and making sure that you do the outreach that you need to do is important. Or, federally qualified healthcare centers. People who live in urban settings tend to be low income, and they tend to be part of our target population because of their low income. And so federally qualified healthcare centers asking specifically if there are Native people, and offering brochures or telling me you've got a tribal person who's willing to work with them to access services can be helpful as well. Many times the federally qualified health centers, the regional clinics or whatever you want to call them, are kind of at wit's end to help all of the people that need help. And if you can have your ADRC folks go in and help do some assistance, they would benefit, and you would be serving, again, your target population, and you might actually snag a Native American or two. So they can be very valuable from a variety of perspectives.
Awesome. And then the last question I see is, do you have a relationship with any of our Oregon tribes? And
I've never even heard of any of your Oregon tribes. No, actually, I've got a relationship with all of the Oregon tribes. So yes, I do. And if people need me to facilitate contact, I'm happy to do so.
Awesome. That was the question. Perfect. Thank you so much.
Yep. Yeah, actually,
okay.
if you want to serve people in Oklahoma, I can help you out there too a little bit. So we'll see how it works.
All right. Well, I'm not seeing any more questions.
I do think, this is Christy, I want to just add something. APD is actively going out with Rebecca Arce, our what am I trying to say, our cultural navigator, and we're going out and talking with tribes about what they want and what they need. And as we're invited, we're not going in and initiating the meetings, but we've extended the invitation that we would be happy to come out. We're going out and talking, and when we have these meetings, we're pulling the AAA in, the APD managers, and various groups to really sit down together with tribal leaders and talk about issues and services available and how we can better coordinate. So that's going to happen. That's happening on a larger level here at the state too. So just FYI.
I had the pleasure of meeting and talking with Rebecca here, I guess, a week or so ago, and what a lovely, lovely person, and she is horribly excited about this opportunity. So I would encourage you to use her and abuse her, and you can tell her I said that. So she was going to try to tune in today, but had another meeting that she had to attend, so that didn't work. Yeah. But she is a lovely individual, and I think will serve you well.
Great. And somebody wants to know if you ever actually visit with our tribe folks in person, or do you just sort of know who they are?
No, whenever I get a chance, the federal budget doesn't really allow me to travel a whole lot, but previous to coming to this area, before I had been there for 30 years, so I had managed to amass a substantial amount of comp and vacation time. So I used to take vacation time and travel to various tribal communities, really all over the United States, to do technical assistance and or get to know the folks. So yeah, I know and have a relationship at least with, I think, all of the tribes in Oregon. So I'm, really willing to help in any way I can. And yeah, I get down there to visit them whenever I can. But since I no longer have the luxury of unlimited vacation time, I'm pretty much stuck here. So most of my work is done by telephone or email.
Yeah. Shelley, I really, really want to thank you so much for being with us today. That was just very full of information. And I'm not seeing any other questions. I want to remind people to watch for an email with a little SurveyMonkey evaluation, and then we will send those results to you, Shelley, so you know what folks had to say. I do want to remind everybody that we do this once a month, and our next webinar will be on September 13th, and it's about elder rights, and Christian Hale is our legal developer. He's going to also talk about some of the definitions around guardianship and conservatorship and some of that kind of thing. So watch for that link to come out toward the end of August. So I'm going to go ahead and sign off now. And again, we thank Shelley for being here, and thanks for Christy for giving me moral support in the room here. And we hope you guys enjoyed it today, and we will talk to you next month. Thanks, Shelley.
Yep, thanks a bunch, guys. Talk to you later.
Okay, bye-bye.